So, your orthodontist has recommended braces. Here is what actually happens over the next 1 to 3 years. Braces use small brackets bonded to each tooth, connected by a thin wire that applies gentle, steady pressure. Over months, the bone around each tooth remodels in response to that light force, and the tooth shifts into place. Braces correct crowding, gaps, overbites, underbites, crossbites, and open bites, improving how the teeth meet and clean. Metal, ceramic, lingual behind the teeth, and self-ligating braces all move teeth the same way, but differ in look and feel. Treatment starts with a full assessment: exam, x-rays, photographs, and digital scans to map the exact bite problem. At the bonding visit, each bracket is glued to a tooth and the arch wire threaded through. The appointment takes 1 to 2 hours. The first 1 to 2 weeks bring soreness and soft food meals as the mouth adapts. Orthodontic wax helps with rubbing. Every 4 to 8 weeks, the orthodontist changes the wire, replaces ties, and may add small elastics to fine-tune the bite. Teeth move gradually. Earlier stages still crowded, later stages progressively straighter and better aligned along the arch. Cleaning is more demanding with braces. Poor hygiene can leave permanent white marks, so brushing and interdental cleaning matter. When treatment is done, braces are removed in one painless appointment, and the tooth surfaces are polished smooth again. Retainers hold the new position while bone stabilizes. Most guidance suggests some retention long-term to keep teeth from drifting back. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.